and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Renee Young, the Community Coordinator, and Katrina Maya, the Systems Navigator at Gateway Community Health Centre located in Tweed, Ontario. I'm also joined by Stephanie Hemrick, the Manager of Community Programs, and Madison Aitkins, the Community Health Worker from Seaway Valley Community Health Centre, which is a CHC located in Cornwall, Ontario. Through the Systems Navigation Access and Partnership, or SNAP project, CHCs are increasing efforts to improve health and social systems navigation access, to strengthen Canada's healthcare landscape, and eliminate health disparities while improving population health outcomes. A stacked lineup. I haven't had four in so long. How are you all doing today?
You're doing great. Thank you.
Great. Perfect.
Good, thanks.
Yeah, it's a big day. I'm very excited. It's been a lot of podcasts, so I'm very happy. Katrina, I want to ask, did I get your last name right? Because I'm going to feel bad if we go through this and I got it wrong.
Yeah, it's Maya.
Maya, perfect. Okay. And on that note, Katrina, I will start with you. If you could tell us a little bit about the community health center that you're at, the community that you serve, and the programs that you offer.
Sorry, it's gonna be Renee.
Oh,
Renee.
sure. Renee, you go first.
Yeah. So we are, yes, in the municipality of Tweed, Ontario. It's a very rural area in Hastings County. More specifically, we're Center Hastings, is how we the county gets divided. So that's typically Tweed, Madoc, Marmora, and then the little hamlets that surround that area. As most CHCs, we have a high percentage of folks living in poverty. We have a high percentage of seniors that live below the poverty line. So our clients is a lot of seniors, complex care, and in an underserved community. We also have a large agricultural community, which sometimes has a unique set of needs. But we've also been seeing a lot of new growth and new people moving into the community in the last, I would say, a couple years, 3 to 5 years. And what's really interesting is that we're seeing a lot of people move back. Maybe they grew up here and have left and are coming back to the area. Gateway CHC has been around for about 33 years. We have a staff of 50, ranging from, we have 3 docs, 3 NPs, allied care, oral health, and a community health team, of course. Our community health team is, we have 2 system navigators, a social worker, outreach worker, and we're extremely lucky to have an early childhood educator on our staff. A small rural CHC, we collaborate with lots of partners in our community, work together to provide programs. We've also been really lucky in the last, I think it's been a year and a half or so. We've had just this little position, it's like a community event planner, and they've supported our community health team, and it's made such a huge difference. It's not like it's just a few hours a week, but it just really helps us to promote and do our programs. We do have programs from early years programming, play groups, one-on-one, parent support, child development support, to having a good baby box, being the good baby box depot. We have focused a lot in the last year on food security. So we, community gardens, we have a community cupboard where we've put free meals, like we put the meals together in a bag, and they just are put up in the waiting room. Kids cooking classes, and our most popular program currently is the one we're going to kind of tell you more about, because it's what our project is about. So we'll kind of tell you more about that, I think, in the next couple questions.
Perfect. We love a segue. I love when leading into the next section. So before we get into the SNAP project, Stephanie, I'll let you tell me a little bit more about Seaway Valley and the community that you serve and the programs that you offer there.
Great, thanks. So Seaway Valley Community Health Centre, as you mentioned, it's located in Cornwall, Ontario, which is about 30 minutes from the Quebec border, an hour outside of Montreal, an hour outside of Ottawa. And we serve a community of over 100,000 people, although Cornwall is smaller, around closer to 50,000 people. So the focus of our community health center, our target populations are low income families with low incomes, older adults, those without primary care, newcomers, and we pay a particular attention to the LGBTQ population as well. So, and then just a note on the newcomers is that Cornwall is a process, or recently, up until recently, was a processing for a center for asylum seekers. So that was a big. We've been seeing a large influx of asylum seekers in our community as well. So, as I mentioned, Seaway Valley, we serve the surrounding areas. The folks that we see, probably similar to Gateway, are may have a lot of barriers, but they're also very medically complex. So the folks that we see here, there's an indicator across kind of the community health center that they call like a SAMI score, which is a complexity of client. So we would have the second highest complexity of client in Ontario. So the average client being 1, and our clients are at about a 2.1. So very medically complex, but also socially complex. Lots of, complex mental health, housing, food security, some of the same things that Renee mentioned as well. So our center is probably at a similar size to Gateway. So we're approaching 50 staff. With some new funding that we're receiving. We have primary care as well. So we have primary care with some physicians, nurse practitioners. And then we have our community program, which include a cardiac rehab program, which we do in coordination with the Heart Institute in Ottawa, a lung health program, which includes visits with a nurse practitioner and a respiratory therapist, and some smoking cessation. We have an outreach program for seniors, some nutrition program, and then we have some group programming as well. And some that are more mental health focused, that focused on a concept called DBT, or dialectical behavior therapy, and stress management. So we're a great center. We're very new compared to Gateway. So Gateway, they're saying 30 years. So we've only been operational since 2009. So we're a new center, which is exciting. Lots of great staff. We have a great interprofessional team, and the system navigation work that we're going to be speaking about is actually really founded in that team approach, and how we've continued to kind of work together on a really kind of different, I would say it's kind of out of a creation of, it was created out of a need, yeah, using that teamwork approach.
Amazing. It's not often that I hear of a new-ish CHC in Ontario, because they are emerging like weeds in BC, which is an absolutely the most positive weed, a beautiful dandelion. So happy to have them emerging there, but it's exciting to hear of newer Ontario CHCs. That's so exciting. So Renee, I will ping pong it back to you, since you had that beautiful segue about what your SNAP project is. So I am very curious to hear more about your SNAP project, and also what you were able to achieve and the impact that it had.
Okay. So our project, it's enhancing some existing programs by incorporating a social prescribing lens or focus into what we do. We are going to focus on one specific program that is mostly older adults that attend, but the program actually has touched, a wide age range of people in different kind of ways. This specific program did start a little bit earlier in 2023 with a bit of a trickle effect. It followed a series of workshops around safe seniors. And then what we noticed was that people didn't leave. And then they got talking, and then they would bring a coffee, and then all of a sudden they brought a snack. And so, you get talking, and it turns out, they're looking for somewhere safe to exercise or walk. And so out of that, the Walk and Talk program was born. And as they prefer to be called now, they are the Walk and Talk Friends. And so then Katrina is actually the one who facilitates the program. Yeah. So she's going to tell us a little more about, the achievements and some of the things that they've done.
So what the funding has really helped us do with to be able to co-design a program with the participants, with the approach that it's open dialogue about their preferences, and making it more possible for them to tailor the program to what their needs are. And as a result, the group expanded their participants, and over time developed stronger relationships. They grew more confident in expressing what their needs are and the information they were seeking. So on various topics like requesting resources or connecting with some of our professionals. And then from there, a sense of belonging to the community kind of has been established, and their involvement in the design process of this group has not only proven the success of it, but it also meets their immediate needs. but also, sorry, but also fostering a sense of belonging and self-advocacy. And sometimes that meant asking for support from a social worker or help acquiring essential aids like walkers. And as the walk and talk friends that they like to be called, it is kind of our most popular social prescription. With the SNAP funding as well, we were able to create other programs to include in our list of available prescriptions. The real success too is also we started with 8 participants, it is now flourished to 42 registered. And with that, mostly what the group has a lot of interest in is not just only the social aspect of it, but having guest speakers that speak to, safety in your home and how to, we've had the fire department come in and they spoke to like how to prepare for a fire. Police department came in, this was a request of theirs to, for winter safety driving. And as well as we had a local lady, she's with the Horticultural Society here, and she spoke to birds in their backyard, how to plant a garden to like maintain your the ecosystem and stuff, and what that meant for how to set up their, I guess, their garden in certain ways. They like to be entertained, so we've had the Cold Creek Cloggers there. We've done more recently bucket drumming, which was it was a lot of fun. They had to learn to play a song, and they did it quite well. And additionally, we've had like some country and folk performers. But I think too, like the significant impact is the relationships that they have developed between them. More specifically, we had a participant who struggled with transportation. And so in the beginning, we provided that for her. But then with time, she had developed a relationship with one of the group participants, and she now provides the ride for her. So it's not so much of a barrier anymore for her. And just the group just stepping outside of their comfort zone. They've started to attend other programs that we have here at the Gateway. And often you'll see 2 or 3 of them grouped together going to those programs. So it's just really spoke to how much the social aspect of it is really needed, or was really needed, especially after COVID. And they've kind of like explored into programs too, like that are more around their health, like meeting their health needs. Because they like to walk inside where we are, they've reached out to Sit and Fit, which is another older age kind of based exercise class, as well as the chair yoga. And then pole walking, which is another big thing in our community here. So kind of also too, speaking up to what they need, we connected over time with one of our community partners through CMHA. She did the Bell Let's Talk Day. And from there, it kind of became apparent that, there were some mental health needs. And some of them had spoke up, feeling very comfortable enough with the group to kind of address those needs in front of them. And then also from that, my colleague and I, we're both system navigators. We took a course on how to facilitate a program on mental health in older adults through CAMH. So we're still facilitating that, and that's been, it's had some pretty good success. Yeah.
Amazing. That was so wonderful. I like that they call each other friends. I'm into the,
Yeah.
I almost wish I lived in the area because it sounds cooler than what me and my friends get up to, because we're just stressed. So that sounds wonderful. Madison, I'm excited to hear about Seaway Valley and the project that you were able to achieve, as well as the impact that the project has had.
Yeah, so we saw the SNAP project as kind of a great chance to formalize something that we've been doing since 2017, which is called Bridges. And Bridges started back then as a way to help clients and also help staff that were kind of helping very complex clients who might have been keeping them up at night kind of thing. And it's grown into a weekly interdisciplinary meeting where staff and volunteers can refer clients for extra support. So this Bridges team is composed of management of community programs and primary care, some primary care team leads, community health workers, health promoters, social workers, a little bit of everything. And sometimes it may also involve external partners. So we've kind of identified three main types of referrals that might come to Bridges, which are social prescribing, complex case management, and system navigation. And from there, the referrals often lead to helping out with things like filling out forms or accessing mental health services, finding housing support, making referrals to a wide range of community agencies. And each client who's referred to Bridges gets followed up by the appropriate staff member or student. And we use our team's shared knowledge and experience to navigate what is often a very complex health system and social system. So far, since Bridges has started, we've supported over 700 referrals, which kind of shows just how important it is within our organization and how consistently we use it. So with the beginning of the SNAP project to formalize this Bridges process, we developed tools like process maps and resource guides, and have evaluated different aspects of Bridges to help understand the experience of the providers and the Bridges staff and our clients themselves. But I think that the largest focus since the beginning of the SNAP project has probably been on sharing our process with other organizations. So we did a literature review on team-based system navigation models, and then after that wrote a brief paper about Bridges, and have since created some presentations to showcase the positive impacts of team-based system navigation models. So in my research, I found very many papers that highlight the importance of interdisciplinary collaboration in improving patient outcomes and reducing healthcare staff burnout, which kind of aligns perfectly with the goals of Bridges. Research has also shown that interprofessional approaches to system navigation help providers understand that wide range of community programs and services that are often available in any given community that oftentimes people don't know about because there's just too much to know, right? And it also helps make the system navigation process less daunting for primary care providers. Additionally, the literature has also proven that interdisciplinary healthcare teams improve patient health outcomes and overall quality of care, which once again supports that team structure that we've implemented in Bridges. So with all of this information in mind, we've participated in the Alliance for Healthier Communities conference on social prescribing back in October, and we had around 75 attendees from across Canada. And there we presented on our system navigation Bridges model and highlight how this interdisciplinary team approach supports care coordination and system navigation and interdisciplinary team support.
Awesome. Thank you so much. So Stephanie, I mean, I think it's a little bit obvious, this question, but just in case someone really wanted to understand why these projects are so important, and from both perspectives, I mean, they're both, the reason I paired you together is, the social prescribing, that lack of isolation, that connecting with another person is very important. But for Seaway Valley, why was it important for that community to have the Bridges program in place?
Well, for us, actually, I feel like, and I referenced it a little bit whenever we were, whenever I was doing the introduction, but for us, it's actually because we realized that we can't get sustained funding around a system navigation position or a link worker. So this is like the little pull that this is so needed. So really around not being able to have that position, and then what are we going to do? How are we going to navigate these super complex clients, and how do we work together to make sure that there's just the care that they need to have? And they were also not just focusing on the deficits, similar to what Renee was saying, but really looking at their strengths as well. So what it is it does provide an opportunity for folks to do that more proactive work, and to say like what matters to you and also what's the matter. So both kind of can happen whenever they're all flowing through that same process. The other piece is that I don't know if folks know, but the healthcare system's a little fragmented. It's extremely difficult to navigate, and there's been a lot of staff changeover. So we've also, this Bridges model does allow for a lot of client advocacy. So it also, because we have, it's a very top-down, bottom-up approach. So we have a lot of buy-in from management. So it's everyone across the organization is supporting folks. Yes, you can attend these meetings. Managers attend. If we need to escalate an issue in an organization, we're able to do so. If we need to advocate, and there's also some small amounts of resources that are available. You know, we can help someone out with a grocery gift card. So it is created a bit, it was definitely created out of a lack of position, but now we really see it as a kind of like a gold standard in terms of that interprofessional care. What would be great, ideally, and you're probably going to say this later, is if we had that funded position integrated into the Bridges team model, right? And then it wouldn't be falling on the desks of everyone on the side of their desks. But yeah, definitely just such a need to navigate such a complex system and support folks.
Amazing. And Renee and Katrina, what do you think in terms of why? I also think it's so obvious having these little friendships and connections be formed, why it's so important. But if there was any other reason why having your subscribing SNAP project exists, why it's so important to have for the Gateway community.
Yeah, I would echo what Stephanie said. You know, the accessibility of accessing resources is so hard. It's so stressful. It's so confusing. And I would say one thing that we did was kind of, you know, so often the programs and all the things are advertised on social media or available online, which just isn't always accessible. So in this group, you know, they want those paper resources. So we provide that. We you know, developed some, provided it for them, you know, information package around a POA and a will. That was something that Katrina created through this. So accessibility, even in something small, just like that. And yeah, the importance of the social well-being in the complete well-being of a person. You know, that's a huge part of this. I think other than that, I would just be repeating what Stephanie said. So yeah.
Yeah, and I mean, no worries. A lot of these sentiments have been echoed in the majority of episodes and even I, like, as someone who has primary health and is fortunate enough to have finally, after many years, gotten a doctor in Toronto, it's still not easy to navigate things, even if you don't have, you know, different, like the complex issues that other people might have. Like it is very complicated just to try to navigate healthcare at all. So I completely understand. Madison, I'm curious what challenges might have occurred while implementing the Bridges program and having the SNAP project, and how those were addressed, but also on the flip side, the successes that came along with your project.
Yeah. So we've definitely had a few minor challenges, but as you said, some great successes as well. So as Stephanie mentioned earlier, we don't have that permanent funded position for a system navigator. So we rely heavily on students to kind of help out with some of this work, especially in the fall semester, we get more student placements. But students aren't always there all the time. So, but we've mitigated this through kind of just leveraging their enthusiasm and their skills that they bring forward. And we've also had some good connections with the St. Lawrence College social services program. So we've gotten a good few students through that program, which has been great. And as well as other health promotion programs. But yeah, we're still gonna try and advocate for that funded position. But additionally, staff workload and burnout was a concern, but because managing complex clients is very overwhelming and we want to make sure that our team isn't burning out. But the interdisciplinary nature of Bridges really helps distribute that workload and make sure that everyone's better supported and the burden isn't falling on one individual person. And additionally, to help with this, we use our kind of blocked off Bridges time to address issues like burnout and moral distress and vicarious trauma. So we have a good network where we all support one another, which is great. We've also faced some challenges with integrating some of our external partners because coordinating between organizations and ensuring smooth follow-ups and referrals can be complex with everyone's very busy schedules. So to streamline this, we've kind of fostered strong relationships with key community organizations and maintained regular communication and collaboration with them. So for example, we met with our local Ontario Health team, which is Great River Ontario Health Team, and we discussed leveraging our internal system navigation model and explore how external physicians and solo practice primary care providers can use our navigation model when they might lack internal resources themselves. So we make sure that these relationships are kind of symbiotic and everyone's benefiting from them, which really helps ensure continuity in our collaboration. But despite these challenges, we've seen a lot of success, and the interdisciplinary approach has made a huge difference in managing our complex cases and reducing staff burnout and overall just improving client outcomes.
Wonderful. Thank you so much. Renee, Katrina, same question. Obviously, what were any challenges, if there were any, and how were they addressed? And also any other successes that you'd like to share about this wonderful project?
Okay. So one of the challenges is really, having that entire care team involved in a social prescription and understanding the benefits of attending a social program. So, new habits are hard to form sometimes. So pushing that extra referral button for social prescribing, it takes time to get into the habit of that, so that, we have the data to pull to support, additional funding applications, that kind of thing. But we just keep talking about it. We talk about social prescribing. We'll present it at the all staff meeting. Katrina is actually going to share a couple stories that we want to present. So that's a challenge. And sometimes it's actually a challenge to even convey or convince the client that this actually does something for your well-being. And so when Katrina calls a person for the first time, quite often she'll just talk about, how this group works, how they're open, they're comfortable, it's a place to be themselves. It's not a staff directed presentation kind of format. It's more, it's a guide on the side, not a stage on a stage. A stage on a stage is how we like to say it. So there's two kind of specific stories that Katrina had to share if we have time.
Okay. So one of the participants that have attended my group, she hadn't been there for a little while, but a concern had come across from an NP. The participant had missed a few of their appointments, and which was not normal for them. They are pretty in tune with their own health, and she wasn't coming to the group either. So it kind of just initiated like a wellness check on and what was going on, and so from there, what had happened was going through the channels of phoning and touching base with the daughter of the patient, and trying to collaborate, how we can keep her more informed, making sure that she was okay. And she was. It turned out that she had phone problems, but she didn't have anybody here local to communicate that to. And then also too, with not having the reminder calls for the walk and talk friends, she didn't know really what was going on with that as well. So she's now being supported with getting email reminders for appointments as well, because it's a constant problem with her phone. And so so it worked out it was a good outcome. Another success story really that I really would like to elaborate on is just that a referral that had come from an MP, quite concerned about the socialization of someone. Obviously the social prescription came through for her to come to the group. It took several attempts for her to come, but she finally did. And when she did come, she presented herself as very anxious, trembling. She just was not sure of what to think of the group. She had socially isolated herself for quite some time, only had connection with her daughter and her granddaughter, and often left with taking care of her granddaughter, which caused her some stress. So when she came to the group, she got to really connect with some of the other ladies, and she started to just kind of be very comfortable with, being around them, and developing a friendship, going to the theater with one of them. She also was a person that had, a participant who had provided a ride for another person to come to the group. And then from there, she wouldn't even shop outside of this town. She was too afraid to drive anywhere. So she started to venture and get a little bit more braver and braver with time. And this was quite a few months into the group that she started to experience this. And so she would then finally go to a salon and get her hair done and feel good about that, and then go to Belleville and local areas for shopping. But what also presented was that she'd had a friend who had kept asking her to come to Wasaga Beach was actually the area, and she was not familiar how to get there, and she was so nervous and anxious. And so we just kind of, worked together. She met with me for several weeks. We went over the map and the route, and she was starting to get a little bit confident. And then with time, when she was ready to do it, I actually physically got in the car with her, programmed her GPS, and did a little, drive with her just to make sure that the GPS was working. And from that point, when I left her, she made her way to Wasaga Beach and all the way home too as well. And she's no longer, isolating herself. She's making friends, and she's managed to get her own place because she was living with her daughter. She's so much more confident. She doesn't come to the group trembling at all. She's always full of smiles. Before, it just seemed she was, she looked sad, and she's so happy to come to the group. And it speaks volumes to the fact that people have really been impacted by COVID and the isolation, that it created.
Absolutely. Thank you. This is always there's always one point in the episode where I get a little choked up. This is now, because that's just such a sweet story. Thank you so much for sharing that. Stephanie, I'll throw it to you next, although I think we sort of got a hint to this answer. If there's a way to sustain the work or sustain the systems navigation access project at all for Seaway Valley.
Yeah, so that was really important for us to be able to sustain the work and actually be able to speak about our model, because previously what we would do is that we would kind of say oh, we're doing this. We have this cool process that we do internally for system navigation, and we had no real data or to support it in terms of, evidence or even a slide deck or being able to kind of share this information. So we will be able to continue doing the work ongoing in an ongoing manner. So those weekly meetings that we have around the system navigation, social prescribing, and then the care coordination that we do at that time. And as well, we'll continue to look out for, the golden kind of ideal would be to have that role that we would love to have. But even in the meantime, we are able to sustain this work and share it with the Great River OHT. So they are looking as a whole at system navigation and, what they're doing. So they were looking at us and they're how could we, as Madison was saying, how could we kind of transplant this into another organization? It gets really complicated when it's outside, because as I think Renee probably, and they know at Gateway, we use an EMR, an electronic medical record. We have consent from client. There's a circle of care. There are all these pieces that make it really easy internally. When you start bringing external partners in, it can get a bit more complicated, but definitely seeing at what we can do to support the health system as a whole. So are we building the capacity of other teams and showing them what we're doing and the best practice? So we're hoping that, our model can be used in other organizations.
Mm-hmm.
Absolutely. And Renee, same question. How do you plan to sustain the project, or do you plan to sustain your SNAP project over at Gateway?
Yes. Yes. The one thing, the mental health for older adults, which is kind of a sparked second program from the walk and talk, that will most definitely continue. It's been so valuable. I would love to learn more about the Bridges model, though. Just wanted to get that in here. It sounds so great. So social prescribing, same thing, the documentation, the pulling the data, we will continue to do that and focus on that. The one thing we'd like to figure out, I guess, and figure out and model our other programs or services after, what has happened in this group, specifically for, a younger age group. How do we kind of develop that? It's like an emergent curriculum for programs that puts ownership onto the participants or the community or the people that are coming. So that's kind of what we'd like to do. I guess I don't know if that really answers the question, but yes, we can plan to continue the programs we have and the project we have. We'd like to see it expanded though into other aspects, other programs.
That's very fair. Totally makes sense. I also appreciate you wanting to learn about each other after almost
Yeah.
every episode I've done with multiple CHCs, especially ones from multiple provinces. They always want to know who's doing what, which leads to hopefully some more work we'll be doing in the fall. But I'm happy to hear. I love when connections get made. It's my favorite thing about my job. So Stephanie, I'd like to ask you, and this is another favorite thing of mine, it's my favorite question of every podcast that I do. What would increased federal or provincial investment allow your CHC to achieve, or how would it impact the SNAP project? So thinking both big and thinking specifically about the SNAP project, what would any funds allow you to achieve?
Yeah, that's great. So I think, I think we do have a great model that if we had more funding, we could really look at scaling it up and sharing it out a really broad perspective, on a really, I don't want to say a roadshow but really sharing what we're doing and what are the elements that are key to the success. So I do think that if we were to receive more funding, that we could look at that, because similar to what the folks from Gateway are saying is that people want to learn and they want to, we know that maybe resources aren't infinite in terms of position. So how can we better work with what we have? So I think just in terms of the actual process that we're doing now. And then the other piece is that if we did receive some type of ongoing funding, a system navigator role could just actually help to alleviate a lot of the stress that does fall on the other interprofessional staff. So we are so fortunate that we have such amazing staff that are just going above and beyond every day, but we have to put so much into place to ensure that they're not burning out and that there's not that moral distress, vicarious trauma, that we're doing all of these pieces just because it's so much. So having additional staff, getting funding for additional staff would just be so helpful. And it's just so not what we usually see. And if they fund, our experience is that recently, when we've received any funding, has been for clinical staff, which is great. We need more doctors, we need more nurse practitioners, but they need to be able to do something with their clients, right? They can only do so much in their 30-minute visit. So we need investments in system navigation, social prescribing, care coordination to really move those clients through the system, or else they just get stuck and they're not progressing and their well-being just isn't improving.
Oh, thank you. And same question to you, Katrina. What would increased federal or provincial investment allow for your entire community health center to do, or specifically the SNAP project?
So providing funding so that we can adequately and appropriately address the needs as they arise. Not don't need to be project based, but we wouldn't have to be able to deliberate so much about what is feasible and what can be done or not done. And the challenge is having the proof and documentation of the value of these programs, right? So in order to apply for the grants or get increased funding, developing a campaign or education series aimed at a younger audience like preteen, teen, and adolescents. Just these generations are kind of, needing more support in face-to-face social interactivity.
And so I was just going to echo to what Stephanie just said too. We can create the referrals, we can create or help with the system navigation, but if the resources aren't there, then people just end up in that circle, waiting for the right resource, waiting for access. So yeah, the funding to be able to create the staff role or staff position that we need, that's specific to our community and our needs. Yeah, and that yes, the projects or the funding isn't project based. We can just do what we need to do to address kind of those unanticipated needs, and just have that part of the programming. operations.
Wonderful.
Mhm.
Thank you all so much for this wonderful episode, Stephanie, Madison, Renee, and Katrina. This was such a wonderful podcast episode. I feel like I learned a lot. As always, I feel inspired at the end. But in case anyone else was feeling inspired or they wanted to learn more about your general community health centers, Madison, I'll start with you and ask, where online would anyone listening go to learn more specifically about Seaway Valley?
Yeah, so our website is seawayvalleychc.ca. We have a ton of information on there that goes into depth about a lot of our programs. And then also we are frequent users of our Facebook page. So we're Seaway Valley Community Health Center on Facebook, and we post about all of our upcoming programs and events on there.
Wonderful. Thank you so much. This episode will be tagged there, so that's perfect. And Katrina, same question. If anyone wanted to learn more about Gateway Community Health Center or any of the programs and services that you offer, including the SNAP project, where would they go?
Often we have lots of stuff posted to our Facebook page, and we also have our community partners locally who join in on sharing all of our events that are going on in programs, as well as our website and on Instagram as well.
Well, Facebook,
Yeah. Yeah, Facebook and Instagram. And we do a lot of on
tweeting.
foot, putting posters around, advertising for all of our programs that we do have here, as well as displaying in storefronts to the Tweed News as well that we use quite a bit.
Yeah, so we actually still advertise in our local newspaper once a week.
Yeah.
There's an ad. Yeah.
Did you see my face go, what? But I'm
Oh, yeah.
I'm so happy. I think that's great that
Yeah.
we're still like the things I can hear my mother saying, if it ain't broke, don't fix it. Like people still read it. I bought a Toronto Star not that long ago. So you know what? The local newspaper still works. I'm glad that you're getting getting the awareness around your programs, because they are so important. The anecdotal evidence and the data collection is so important, and these programs need to continue to exist for all of the complex people and the needs of everybody who is a client at our various community health centers. Again, I want to thank all four of you for participating in this episode of Community Matters. Thank you so much.
Thank
Thank
you.
you.
Thank you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centers. To learn more about our association and the important work of community health centers across Canada, go to www.cachc.ca.